10 states, approximately 9 million inhabitants, a region split by the White Nile, South Sudan. After the end of its last civil war in 2005, South Sudan became an autonomous region striving for independence. Since 1998, Malteser International has been in charge of a hospital in the city of Ye, near the border with Uganda and the Democratic Republic of Congo. The hospital successfully provides medical services to tuberculosis and leprosy patients, and since 2002, also to patients suffering from sleeping sickness, which is widespread in tropical Africa. Joseph Kamis visits a leprosy patient. Once a month, he checks the healing process of several patients and takes care that they properly look after themselves. Experience shows that particularly patients who can't be treated at the health center are more likely to suffer a relapse. Leprosy continues to be widespread in Africa. There's a lack of education, proper treatment, and medicine. This infectious disease has been known since ancient times. The infection attacks the skin and nerves. Patients suffer from a loss of sensation and sometimes a weakness of muscles that can cause serious problems, in particular in the facial region, the hands, and the lower extremities. Victims of leprosy suffer from a deficiency of the peripheral nervous system, resulting in a lack of sensation to heat, cold, and pain, particularly in the limbs. The loss of sensation can lead to unnoticed injuries, which may in turn become infected. Patients might then fall victim to other perilous diseases or repeated injuries. Such repeated injuries can mean people with leprosy lose fingers and toes. Judita Nyoka has suffered from leprosy for almost 40 years. She still remembers how it started.
Levekiro nako sarabadilin ke mugun dingin naganan yani fane akitiso nakera levekiro suluji kiro yani kona dumugunyo linguro dumugunyo kiro li rekena levena ka dingin naganan suluji yani yumunda lungiro kuye lotatan lukala sa levekiro suluji kerot ke mogon lililing mogonyo kerot na suluji ke kereju meni anyanya wanyo aska kereji meni anyanya wan.
Other symptoms of the disease may include inflammation of the upper respiratory tract and the eyes, along with gradual muscle weakness. Some patients are unable to close their eyes anymore, resulting in dehydration, inflammation, and a lack of sleep. Judita Nyoka has to cope with all of that, but thinks she could have had it worse.
Mene kwa hii jonganyo nagananja jonganinu iri ya nankiro kuroji tagaer naga I tudara jonanan yikasin kude ke dafan kajumadi dafan ke kaju kajulling sit at dikasin asa besi kuyati dikasin kini bunga nan mete I get by kwana kendanan farikan wurenyo koti kajunaga nan bai wure ma ikpejekide nana ke keduka kongusi asa bunga yani pejekide nama ikona mpako keni buga namponi kumokosi ama iketi fiong kajuna bai rogana fiong asa ma ifiong kine koko kudula naro rogana nengo naga konjini farikan ge bai naga lelengunda mokosike
ai koya It's still not very clear how leprosy is transmitted. The risk of infection, however, is not considered to be very high. Depending on the stage of the disease, the necessary treatment with different drugs can take months or even years. Even many years after disease onset, patients like Judita Nyoka still need continuous treatment in order to lead a nearly normal life.
So this is part of the home-based care. She always soaks her legs like that in order to prevent it from... It is always dry. You know, it has lost the nerves already damaged. It is always dry and it cracks. When it is kept dry, it cracks and then it forms wounds. Then bacteria enters and spreads, and that's how she had lost the toes.
As with most other diseases, leprosy also affects people's social life. Those affected are often marginalized and excluded from society. In Africa, leprosy is often still attributed to witchcraft or sorcery. Leprosy patients are stigmatized and ostracized. They have difficulties finding work and are thus not able to make a living. Help should therefore not be restricted to medical treatment alone.
And then we are working together with the leprosy patients to encourage the community, the leaders, to look at leprosy as a normal disease. They have to live normal lives, not isolated and those kind of situations.